Welcome back. When you hear that theme song, Ganges and the Nile, you know that it's Brighter Morning with Bhoe. We are on 97.5 FM, Hot Like Pepper Radio, and we are on MCTV, which you are looking at now, Multicultural TV in Trinidad and Tobago, beaming from Amplia 119, Digicel 22, Airlink 18, and soon Flow, and we will give you the number of the cable channel. We are also on Facebook.com/TT MCTV, and we want you to continue with us because we're going to have a good discussion with Dr. James Hospedales, former head of CARPHA and former head of CAREC, public health specialist with long years in the field and high levels of competence in the field. So we'll have a discussion with him, and we want to begin to engage him almost immediately. U97.5 FM and MCTV are dedicated to local and regional programming and is a national producer of multicultural programs. And this station, both the radio and the television station, partners with local and regional producers of local and Caribbean programs. So we look forward to talking with you, to engaging you. Our numbers are 609-6283, 609-6284. You are welcome to call and express your point of view and discuss. Now we'll ask for if we can make connection with Dr. James Hospedales. Is he on the line? Did we contact him? He's on now? All right. Well, we are going to be discussing COVID and other issues, but I think that we need to take note of certain things. For instance, the Ministry of Health officials, Dr. Abdul indicated to us, for instance, that there is no presence of the Delta variant here. Do we have the clip from Barbados? So let us play that. Sorry? Oh, a call on the line? Well, let's have the call. Yeah. Good morning.
Yes, good morning.
Hi.
Yes, good morning.
Yes, what can I do for you? What would you like to say?
Well, I wouldn't tell you what you could do for me because you might not afford it.
All right.
What I would say is, you know, I'm glad you're on the program. Hopefully it would make a difference. I don't know what sort of big difference these programs would make because, you know, the people in authority don't really seem to care much about the people who put them there, right? And I was just thinking, you're bringing in 800,000 vaccines into the country, no problem. But what would be the expiry date on those vaccines, and what will happen if 400,000 people refuse to take the vaccine, you know, because that's their right? What are you going to do with those vaccines?
All right. Well, the first thing is that these are vaccines that are purchased from the government of China. One uncertain issue remains the cost of the vaccines, because the Prime Minister indicated that the cost of the vaccines cannot be revealed because of a non-disclosure agreement with the government of China. But the Minister of Finance had some time ago indicated that the cost was about $15 and they were renegotiating downwards. So I think that we can expect that the cost of the vaccine is likely to be somewhere between $8 and $12 at the end of the negotiation. I cannot understand this business of non-disclosure arrangements when this is taxpayers' money at work. The other issue is, when will it expire? I think if they bought the vaccines, we'll probably have a reasonable expiry date, so that is not likely to be a problem. And I think we will have no trouble vaccinating 400,000 more people with 2 doses of vaccines. I think the problem will happen thereafter. I think right now there's a fair amount of vaccine anxiety because people do not want to get sick. They do not want to get infected. They want to protect themselves. Some people want to travel, etc. But I think once we cross the 500, 600,000 people threshold, we will have some vaccine hesitancy settling in. And once that happens, we may have to use various means of persuasion. You mentioned that the not taking a vaccine is your right. I think that there is some controversy about that. The democracy demands that people have a choice and make choices about their own lives, and that is true. And the president of the industrial court indicated that the worker can elect to take a vaccine or not take it, and that person cannot be debarred from work. But the dean of the law school at the University of the West Indies, Professor Rosemary Bell Antoine, has indicated that the precedent does exist for compulsory vaccination. We have done it with children in schools, for other things, and that the precedent has already been set. So we will talk with her sometime next week to find out about that, okay? But I want to thank the caller for calling in. I want to thank him for his good wishes, and I want to thank him for his very serious question. Anybody else on the line? Can we play the clip from Barbados?
We are monitoring 3 young children who presented to Winston Scott Polyclinic, all independently. And these children presented with gastrointestinal symptoms. This is a bit of abdominal pain and diarrhea. Quite an unusual presentation for COVID. So we should keep that in mind. So the situation in Barbados is that we are not in a good place. And that's why we are again reaching out to the public for their complete cooperation. We have several cases that we are contact tracing. We intend to put all primary contacts into hotels across Barbados until they are first tested and second tested.
All right. Thank you very much for that clip. As you see there, the representative of the Ministry of Health in Barbados indicating that the Delta variant was present in Barbados, which is not too far from here, and to which we travel back and forth, both sets of citizens from both islands, and that there were peculiar symptoms manifesting because of that Delta variant. So the government has indicated that we can protect ourselves from it by testing for the Delta variant as passengers arrive in Trinidad and Tobago. We wait to see how that will evolve. Do we have Dr. Hospedales on the phone, on the system? Okay. All right. We also have, do we have a clip from Southeast Asia on what's happening with the Delta variant there? Well, we know the situation. We have a problem in Argentina with COVID, and that is leading to hunger in that country. One of the consequences of COVID is the economic devastation that it wreaks upon a country, because countries are forced to close their doors, sometimes their borders, etc., as in fact we have done. We have recently partially opened up. And we have the Delta variant raging in Thailand and South Korea, and talk of a third booster vaccine shot is emerging, and a new controversy is emerging about whether we should mix the vaccines, which is what they are doing in Thailand now, and that is also spreading in Indonesia and Malaysia. We have a caller on the line, and we'll take the next call. Yes, good morning. Good morning. Is he on? Sorry about that. Okay, we'll go on to our guest, Dr. James Hospedales. And thank you very much, Dr. Hospedales, for joining me on the show.
Morning.
Morning. Long time no see. I'm glad to see you. You're looking well.
Thank you. You look fairly lively yourself.
Yeah, well, you know me, I am a bundle of energy, and I, like to do things, and I try to keep myself happy and productive, and as I'm sure you do the same. Now, James, I'll get right into it. You don't mind if I call you James, right? I mean, we've known each other a long time. You have made a significant contribution to public health in the region at CAREC and at CARPHA. What do you value most about your career in public health so far?
The opportunity to have made a difference, to have saved lives, prevented epidemics, and built up capacity to be able to do that in countries and in the region.
Okay, and you've done solid work on that for many, many years, and we want to thank you for your service, not just to Trinidad and Tobago, but to the entire region. Did you ever think that while you served at these institutions like CAREC and CARPHA, that you would ever see a period such as this, when the world is going through COVID and is likely to be going through this for some time?
That's a good question, Bhoe. I think much of our public health careers, and certainly mine in regional and global public health, you consider the possibility of something like this. The world has had about 10 or so pandemics and public health emergencies of international concern in the last century, beginning with the Spanish flu epidemic. Spanish flu. It probably began in a pig farm in Arkansas. Beginning with that epidemic 100 years ago, 1918, 1919. And that taught us a lot of things, including that the virus is patient. It was a flu virus, H1N1, and we'll talk more about it later. And so in all of my career, from training in the 70s at medical school, and certainly in 80s and 90s in preparation at the Epidemic Intelligence Service, head of CAREC, this is the sort of thing you try to prepare for. And you try to warn governments of the need to have a strong public health capacity installed, people who are trained, networks in place, and so on. You build up your partnerships with CDC, with the WHO system. I served in PAHO, Pan American Health, for many years, and that was also in that position. For example, 2009, I was working in Washington, Bhoe, and one of the pandemics that has been declared by the WHO struck, and that was the H1N1 epidemic flu that began probably in the south of Mexico. Nobody's really sure, but that had echoes of the virus from 1918, 1919. So in my public health training, in my work in the UK, in the Centers for Disease Control, definitely at CAREC and in the WHO PAHO system, you prepare for this. More recently, working with the Crime and Security Agency, working with SEDIMA, the Regional Security Service, there was a coming together of those, realizing that public health emergencies and epidemics can give rise to security problems, can give rise to other challenges as well. And then you have the natural disasters in the Caribbean, the hurricanes that soften you up, if you will. The 2009 epidemic had hints of what was to come, including the vulnerability of people who are older and less fit and have non-communicable diseases, very susceptible to the influenza virus then and the COVID virus now. But did I ever think we would see something like this? No, not quite. You have an international health regulations framework, and that's the basis by which the world deals with these potential pandemics, and there's a whole system for calling them or not calling them, and it's supposed to allow you to contain things without undue restrictions to trade and travel. Without undue restrictions to trade and travel, and that clearly has not been the case. We are in a situation that is unprecedented. Some people followed science and public health advice, acted early, acted decisively, and have saved a lot of lives, and somehow managed to balance it and keep the livelihood side going. We did not really prepare for this, and neither can you completely. It's hard to prepare. You have a left brain rational part that has all these plans and everything, and they're based on science. Go ahead.
When you say we did not plan for it, I don't think you're talking about Trinidad and Tobago and the region. I think you're talking about the world. You're
Correct.
talking about the world, right?
Yeah.
All right.
Yes, because the tenets of the international health regulations are to be able to control these things without a lot of impact on trade and travel. And clearly that did not happen from the get-go. The level of impact on deaths, the way it was transmitted. I first heard about COVID in late 2019. And then on February the 12th, I was talking to a colleague in Beijing of 2020. And he was telling me what was happening with asymptomatic transmission, and that it had spread widely in China by that time. And I thought, oh my God, it's going to spread around the world.
Yes. How about the Caribbean? How prepared were we for it once it had taken place and we had some time to see what was happening in China, the US, Italy, United Kingdom, etc.? Because those countries were hit first. How prepared were we in the Caribbean, and how resilient have we found our public health capacity in the region?
Good question, and a hard one to answer with the enormous diversity of territories we have in the Caribbean, both in size, geographic size, population size, and in per capita in income, in wealth, with the kind of travel that we used to have before. Being island states, it perhaps made it a little easier because you could close borders, you can isolate easier and earlier and contain things than those who cannot. I think Trinidad and Tobago is somewhat of an exception because it never had closed borders with South America. For many reasons. This is not casting aspersions, it's just that's the reality. And when the epidemic surged in Brazil and right up through Venezuela, it was natural the wave would spill over into Trinidad and Tobago given the close connections. But the island status, middle-income countries, fairly well-developed public health and primary healthcare infrastructure means relatively well prepared compared to some places. And a population we have a population that's fairly educated and literate, but I think compliance at the population level is, let's say it's not like what it is in Asia that went through the SARS epidemic, went through pandemic, went through MERS-CoV, and they're much more sensitized and accustomed to using masks and other measures, actually since the 50s with the Asian flu pandemics. So those countries have much more acceptance of public health measures. Perhaps in the Caribbean, we have less. So I think the big challenge is we'll come on to that, no doubt. The major control measure now would be vaccination, while continuing the wearing of masks and the distancing and so on. But that's a challenge, as we know, the availability of vaccines. So, as a general statement, countries did well, but this virus is patient. I say that because you could keep your guard up and things seem to be going good, and you relax, and it comes back in. In TNT, after this long period of
and it's a
control,
smart virus. It's a smart virus in that sense, which simply waits for the opportunity to mutate and evolve, doesn't it?
Yes, it both waits, but it's also bobbing and weaving, if you will. It's changing very rapidly its profile, its shape. So the immune system has a harder time getting it, and that's the idea with the Delta variant that has come along. Perhaps a little less of a severe disease, but more easily transmitted. So it keeps changing, and that's one of the challenges with the vaccine. Yes.
How long you think COVID is going to last? What is your view of what lies
Decades.
ahead? Now, I know I'm asking you a speculative question here, but you are a well-grounded scientist. You have a lot of experience in this. What do you think?
Well, I'll answer it in a couple of ways. I think it'll be here for decades, unless there was some unprecedented elimination effort as how we've eliminated measles in this part of the world anyway, it's come back, or how we eliminated smallpox. That's the clearest example, perhaps, of global elimination. Unless we do that, COVID will be here for years at least. And so the talk of post-COVID, we need to be careful because new variants are emerging. Not everybody is vaccinated. It'll be a while before we are post-COVID. 1. 2, we can expect more epidemics and pandemics. I can talk about that a bit later. And therefore, you have to be in a greater state of preparedness. As people have been warned for a long time that this sort of thing was coming. I wrote a piece in the British Medical Journal about this last year, that it's a wake-up call. This is what we've been saying in public health for a long time. These sorts of things are possible, and they will have enormous consequences. And the forces lining them up are getting more intense, that there will be more of them.
One of my, I don't know if I'm right or wrong about this, but I really have a strong feeling about it. I really feel that the WHO, in my view, did not rise to the occasion in this pandemic in helping to create the conditions in which countries could manage this pandemic with a lot more success. I also think that they did not play enough of a role in ensuring the fairness of vaccine distribution across the world between the industrialized and the developing world. And I know that some of that was caused by the damage done by former President Trump in his attack on the WHO and the WHO chairman. But I really think even now, I find it very difficult to understand, for instance, why the WHO could not provide our final batch of 33,000 vaccines to Trinidad and Tobago, and really why they are literally out of the pandemic control situation globally, or so it seems to me. But you can correct me and add value from your perspective. I will be grateful.
I agree. very careful in criticizing WHO in public. I think the context.
We're criticize. We're trying to get at the facts here.
Yeah, no, I hear you. I'm choosing my words carefully. There's just been a big mission, as you know, under the chairmanship of former Prime Minister of Australia, Helen Clark. In some ways, I consider they did not go far enough. Other people think that they're calling for too much power for WHO and too much funding. The problem is not just WHO now. The problem is member states and how people behave. So if you take the instance of nationalism and holding on to whatever you have, we focus on the vaccines now. But at the start of this, a year ago, March, April, when the epidemic blew up in Europe, and Italy was the first to suddenly face hospitals overflowing and people dying in large numbers, they called within the European Union for a treaty assistance under the treaty that they have for emergency protective equipment for their staff. You know what happened? There was a deafening silence from the rest of the European Union. People held on. They didn't want to part with their own because they thought they would need it for their populations. Although there was a treaty in place for assistance, and this is within the European Union, you saw a breaking of solidarity within Europe. And that is multiplied all over the world, within countries, between the rich and the poor. So that's one point. The second is the WHO has been neglected and starved of the resources that it needs for years. I speak as an official who worked in the system and who was responsible for managing the Caribbean Epidemiology Service. For years, WHO has gradually been contracting because of decline in the budget in real terms and other challenges. Donors and rich countries pick what they want to work on and they finance that, and they finance nothing else, whether it's HIV, TB, malaria, specific things, rather than strengthening the system to tackle things as a whole and to be ready for whatever comes. So I put some of the blame, if you will, or the responsibility or the contribution to the situation that we're in squarely in the member states and the various parts of the world and the way people tend to behave and neglect of the World Health Organization. And that's why the commission that just inquired them has been saying, look, they need better funding, they need better authorities. Next, you give them the funding and you give them the authorities. Will member states adhere? What has happened in the world has just been unbelievable. I could not have believed. You asked me earlier, could I have believed this? I could have believed we would have had a pandemic. I could have believed, and I was trained for all my life to prepare for things like this and prepare systems for it. But I couldn't prepare. I don't know how to deal so well with the lies, the obfuscation, the extreme manifestation of this nationalism. You expect people to want to look after their own and lead in that direction. But we have treaties that rise above that and say, look, if we take it all together, we'll do better than if we fracture it. So we have a world where trust has badly eroded in the WHO and in other systems. You have a fractured architecture with so many actors rather than concentrating efforts through an organization, which is the agreed one. Now, WHO has plenty of problems. I worked in it as well. Which organization doesn't? It has a higher calling in terms of trying to protect public health and secure and safeguard the world and work with the countries of the world. I too feel a bit it could or should be more significantly inserted into the architecture of how we're responding to this epidemic. The response goes way beyond health, of course. This is, the CAREC heads of government met, I don't know if they're still doing it, but they met every month last year. They never used to do that before. Once or twice a year they would meet, but they met every month. So there's been some interesting, that sense of how urgent it was, how important it was, obviously, because people have been suffering, both lives lost, and in the case of the Caribbean, perhaps more impact on the economies and on livelihoods than on actual lives because of what we talked about earlier, shutting down and acting early and decisively with your public health measures. The many of the things that the WHO did propose that were reasonable to do were not properly subscribed or not supported. So it's a complicated answer, Bo, and when you hold up that mirror, it's all of us in a way. The institution itself, the member states that make it up, the chronic history of underfinancing and under-resourcing. Don't expect something that's starving and hungry to suddenly do well when it faces the biggest challenge we've ever had thrown at us.
Yeah, well, I like your answer, I must say. Basically, you are saying that the issue of nationalism and the assertion of nationalism really wounded international organizations with global responsibility, such as WHO. I suspect that the suspension of American support, U.S. support for WHO by Trump at a critical point in time did not help either with the confidence of WHO in the context of the pandemic. And
that is what I could not have prepared for.
Yes.
How could the leader of the free world withdraw support from the organization and agree to fight epidemics in the world at that time, you know?
So it wounded the institution badly, and it wounded its confidence, and it made it difficult for it to function in this pandemic. Now, that is a whole other discussion we might have, but I want to get to what you are doing now. You are now head of what is called Earthlink. Can you explain what that is about?
Sure, Bo. It's EarthMedic and EarthNurse.
EarthMedic,
and,
yeah, sorry.
EarthMedic, you can just get a. Can you see that there? Those are our logos.
Yes.
And those logos show that the Earth is at the center of tumultuous change. Those are the hurricane bands of a hurricane in the Caribbean.
So the symbol is like being in the center of the eye of a
a storm.
hurricane. Yeah.
Yes. The whole Earth is subject to gripping change as climate change unfolds and the planet becomes warmer. And that constitutes a health crisis unprecedented. The COVID pandemic that we're just talking about is connected to it. Part of an increasing frequency with which we're seeing pandemic diseases and breakdowns in natural systems. So EarthMedic was founded last year, particularly to awaken the health professions, doctors, nurses, and others to the fact that climate change is a health crisis. It's a health crisis because it's destroying the conditions for life.
This is your initiative.
Yes, this is the initiative of a boy from the South.
All right.
I mean, south from Kearney and south from the south of the world. You know, somebody was speaking to me last week and they assumed our headquarters was in London.
Yes, of course, because they don't expect people in small countries and developing countries and countries of the South to be doing anything for the world. It's a hell of a perception. And they also do not expect you to think big. You must always think small, and you must always be concerned about your own direct problems. So congratulations on that, but you were talking about it. Talk a little bit. I just want to establish two things, though, that you said. One is that you are saying that there is a direct link between climate change and health-related matters. You are saying that loud and clear. Is that correct?
Absolutely.
And secondly, you said before that COVID is going to be with us for a lingering period. It will be with us for some time. Am I correct in that? Okay. Develop the idea of the link between climate change and health-related issues for a general public to understand.
Okay, let's change a gear then. We're talking, somebody doesn't know about this. Climate change, what is that? And what is the connection to health? Why are you worried about it? What should I do about it if you say it's a problem? Well, when your mother tells you, you better take your umbrella, yes boy, it looked like it's going to rain this afternoon. That's the weather she's talking about. Short-term changes in atmospheric conditions. When an old seaman tells you, the sea never used to come this high when I was a boy, Or they say, there are no more fish, there always used to be fish. You're talking about change over a long period of time. When somebody says, like I can tell you, the storms we used to get when I was in the Caribbean Disaster Response Team, one big one per year in the 80s and then in the 90s. And that's changed because now you get mega storms and you get several of them at the same time. So those long-term changes in weather patterns are what we call climate change. Globally, the major driver of that is the warming of our atmosphere because of the emission of what's called greenhouse gases from cars, trucks, agriculture, destruction of forests, burning, many, many reasons why generating energy that is happening. And the planet has warmed by about 1 degree since industrialization. Why is that important? 1 degree doesn't sound like very much. Well, to warm our whole planet up by 1 degree, you have to fire off one Hiroshima bomb 5 times a second for 25 years. That's how long you got to keep it up and to heat up the planet by 1 degree. And the consequences of that heat, Bhoe, and I'm coming to the question you asked, why is this significant to health? Let us pause for a moment, divorce ourselves from all the fascination we had with the American political elections last year, and think of what happened globally. If you were a planet doctor, if you were on duty in the central galaxy, the alarm bells on your dashboard would be going off because this planet out here is in trouble. Why am I saying that? Well, record heat and carbon dioxide levels. Fires like we never saw, apocalyptic fires from Australia to California to the Arctic, flooding,
all over
locust
Asia,
plagues.
in our own country,
yes,
Trinidad and Tobago.
In our own country. So Trinidad and Tobago has warmed itself by about 1 degree or a bit. And what I observe living in the Port of Spain watershed is every year the fires are going further and lasting longer. We've lost about 300,000 acres of the original rainforest cover of the island. And remember, we're really part of that sort of Venezuelan continuum with the mainland. So it's hotter and drier than it used to be. The fires spread longer, last longer. And what does that mean? In the rainy season, you're going to get floods. So this thing is connected. Then you're going to get disease outbreaks. You're going to get people's property damage, businesses damaged, gastroenteritis, leptospirosis, and disruption to services. So in many ways, the global climate picture plays out at the small level in Trinidad and the Caribbean region. We're getting more superstorms. If I have been to some of the islands after a big superstorm, and it's unbelievable.
Yeah.
And that's when you see that, you begin to realize, well, of course you must be able to get finance based on vulnerability rather than just the international world is rigged. Fight this vulnerability.
Yes.
Finance based on index on which it is based. So your water security, your food security. When it gets drier and hotter and you can't grow crops, where the food coming from? You know? So those are concerned about this, and I was led to found EarthMedic and EarthNurse Foundation for Planetary Health to focus on the climate crisis and to mobilize health professionals in particular to get informed and get equipped and to take action.
James, we're going to have to close up because we have to break at 8 o'clock and the program comes to an end at 8. We have to break for the news. But I want to let you know that I'm going to pursue this issue of climate change, and the connection between climate change and health is important. So if you don't mind, I'm going to ask you to come on again so we can talk. I'm talking to one of your colleagues, a Trinidadian from NOAA, on the 28th of this month on the climate change issues and what's happening. And
that Roger Poole.
Hello? And I'm also going to try to connect with the Caribbean Institute for Climate Change and try to understand what is happening, not just globally, but what's happening in the region. At NOAA, they are looking at the hemisphere so we can get a comparative sense of what is happening. But I'm particularly interested not only in the connection between climate change and its impact and the consequent diseases that can spread or the negative effects on the population, but the relationship between things like diabetes, hypertension, and the other non-communicable disease. If you could just spend 1 minute on that, and we've got a close-up on that, what is the connection between climate change and that?
Your fossil fuel combined with motorized transport, you see the
all right, James.
Also driving climate change.
James, Dr. Hospedales, we're going to have to continue this discussion another time because we're breaking up, so we're not hearing what you're saying. I want to thank you very much for being on the program. As I said, I will call you again, and we'll have a continuing discussion on this very, very important matter, not only for the human race and the world system, but for the Caribbean people who live here and certainly the people of Trinidad and Tobago. I want to thank you for being with me this morning. I want to thank listeners for tuning in, and I want to thank callers for calling in, and I want to apologize to the caller who lost his call along the way. Please continue to call. Take the number down, 609-6283, 609-6284. We'll have 2 guests tomorrow, and you can call and discuss those issues. This is Brighter Morning with Bhoe on U97.5 Hot Like Pepper Radio and MCTV Multicultural TV in Trinidad and Tobago and the Caribbean region. I hand over now to Andrew Chan for the news.